Hello everyone, I'm Urologist Erdem Akkaya. Today we will talk about Prolactin and Dostinex. As it is known, prolactin is very important in women. It is a hormone that secretes milk from the breast. Until the last 15 to 20 years, it was not known that it was actually so important for sexuality and for erection in men. According to recent studies, problems such as erectile dysfunction, premature ejaculation, loss of sex drive are more common in men with low prolactin levels. It has also been revealed that cardiovascular diseases and problems related to insulin resistance are more common. We already know that high prolactin levels are already associated with sexual dysfunction and conditions such as breast enlargement, gynecomastia, and weight gain. In other words, both high and low prolactin levels can cause problems. When we look at the causes that increase prolactin, we see that the most common cause is antidepressant drugs taken externally, SSRI inhibitors, that is, drugs that increase serotonin levels in the brain. Because prolactin is actually a mirror of serotonin and dopamine levels in our brain. As serotonin increases in the brain, prolactin levels increase. As dopamine levels increase, prolactin levels decrease. Dostinex, the drug we use to lower prolactin, actually creates dopamine in the brain and prolactin levels drop. Prolactin is also very related to the thyroid hormone and the thyroid gland. If the thyroid gland is not functioning properly, prolactin may increase and testosterone may decrease due to this. Apart from that, anabolic users sometimes have increased prolactin levels due to the anabolic substances they use. Especially after the use of trenbolone, proestrogenic effects may occur, and prolactin levels may increase. This is because the drug puts pressure on the thyroid and as a result, the body may inadvertently produce prolactin while trying to produce thyroid hormone. I see a wrong practice here, friends. Sometimes I see high doses of Dostinex used during the PCT period after an anabolic cycle is finished. I mean, under normal conditions, it is used once a week, but there are those who use it every 2 or 3 days in high doses. Testosterone decreases when the cycle is over anyway. And when Dostinex is used as well, the prolactin is decreased rapidly. Then erectile dysfunction and loss of sex drive can occur strongly in the person. This can of course lead to troubling consequences. One can lose weight to lower prolactin. If medication is to be used, it should be done in a controlled manner under the supervision of a doctor, after having blood tests. Apart from that, if you want to raise prolactin, weight gain may be useful. Or the amino acid tryptophan, 5-hydroxytryptophan, can be taken from outside. 5-hydroxytryptophan is sold in supplement stores and pharmacies. Tryptophan turns into serotonin in the brain. And the rise in prolactin due to the increase in serotonin is possible to bring it into the normal range. For a healthy erection, prolactin levels need to be in balance, neither high nor low. It is also certain that if your prolactin level, let's say, is slightly above the normal limit or below the normal limit, it doesn't mean that you will definitely have sexual dysfunction. Because we see many patients like this. There were patients who came to me with a prolactin level of 70 but had no sexual complaints. But there were also patients with a prolactin level of 30 to 35 whose functions improved after lowering the prolactin level more. So we cannot set clear boundaries on this. But 70, 80, 90, of course, are very high values. When prolactin is also high, there may be a condition called macroprolactinemia. In other words, when we measure bound prolactin in the blood, it can give us a false elevation like macroprolactinemia. So if you have a problem with your prolactin level, you need to go to a doctor who deals with these things. Endocrinology deals with these issues. This is how prolactin and Dostinex are in general. Thank you for listening. Best regards.